everybody, and welcome back to the I Don't Know Running podcast, where we share our experiences that make running fun and sometimes not so fun. I'm Lewis, and I'm a self-admitted lazy ultra runner, and I got nothing. Welcome to the show.
And I'm not surprised. I'm Mitch. I'm thinking about changing, with permission, if we could change this to a drinking podcast.
I mean, I'm having a drink.
Right.
Just doesn't have alcohol.
Just not, the running part just isn't happening enough right now.
Happening now?
Well, this you got to be drinking the lemonade of this podcast by the time you're done.
This doesn't get you running. I don't know what will.
So here's the thing. Terrence showed up today, and it's like, oh, this is a perfect time to talk about this stuff.
So yes, I know. I'm like the guest on the podcast that is, surprise. Hey, guess what? You're the guest today.
You're the guest, even though you're on the show all the time.
So
you've definitely been on the most.
All right, I'll take that.
You're probably on more than Mitch anymore.
True. Yeah.
Lately.
Hey, that brings us to the solution to his problem, right?
Yeah.
2 words, Mitch. I got 2 words for you. Go.
That was 1 word. G, 2 letters. G-O.
Oh, I was going to go show up.
Oh. This is the Throw Mitch Under the Bus episode. What else?
Wait, this is backwards. We were going to throw Terrence under the bus, right?
I'm driving the bus.
Yeah.
Well, you want to talk about...
my Achilles. So I've been working with Terrence, and I think I sent him a text the other day. I didn't get a response. I said, can we just cut it off?
What?
Can we just cut my foot off?
I was looking for my sharp knife at that point. So.
Cut my foot off, and I can run with one of those little springy things.
Yeah.
I know a guy.
That's only the holdup.
Yeah,
right?
You remember I'm from South Africa. We hook you up with Blade Runner hookup.
Yeah. I think he's getting out really soon. I think he's out. Or no, that was the Australian. Wait, that was the Australian.
No,
Is that
South African.
South African?
Yeah.
Okay.
So we've been working through this, and I always try to...
What are we working through, Mitch?
Okay, yeah. So
my Achilles issues with that. So I've been seeing you, and
how have you hurt your Achilles?
And I talk. I
Poor
talk
strength.
People need folks listening today. They need a backstory.
Mitch is trying to say all kinds of stuff today, and has been lobbing.
Bam. I wasn't thrown into the bus yet. I was just saying that we've talked about it a few times on the podcast, and I was thinking hey, with you on, we can talk about.
Mitch's
I'm okay.
issues.
I'm okay with being picked on about it because I probably haven't treated it very nice. And it was probably how it really started is I probably built up miles too quickly from my knee injury, and I ran a marathon, and it kind of acted up then. And then I kind of ignored it all of this time.
Wasn't there some hiking issue as well with this?
Well,
There was hiking involved.
There's hiking involved.
I don't think it was an injury.
Yeah, that didn't make it. That just didn't help. Right.
Yeah.
I can review my notes on this and let you know.
There's a file.
Oh, I'm going back to drinking.
There's a file on
I do. It's like
PT
I can
Sports
access it right here. Anyways, go on.
I did, and you did. You helped me a lot because I knew I was going to go. That's when I first started seeing you. I was ignoring it for a long time. And I was like, hey, get me to the point where I can go out and I can pace Laura for that 100-miler. And we have talked about it on the podcast. And then I'm going to run a marathon the next week. And then, yes, there was hiking involved because that week after that marathon, I did a bunch of hiking and it flared it up bad. And that's when it's like I come and see you and you're like, okay, it is definitely flared up. We're going to put you in a boot and we're going to shut you down.
Yeah, on the PT Sports Pro, You Don't Know What You Don't Know episode, we talked a little bit about that. But we haven't talked about that a ton on the I Don't Know running podcast side of things.
Okay.
Right. So it's just trying to, okay, so here I am. And I kind of wanted to, I kind of want to break it down, like the things that we've done, and I've been doing, in part of it, I think you sent me a text back about the Achilles heel 1.2 about, it does suck and it's going to take a long time. And I have been doing the exercises. I've been doing the stretching. I've been doing things. And we've talked about this too, is it's not fast enough for me.
Yeah.
And I need to be able to chill out a little bit, but I'm trying to do things in the same.
So again, just to give context and a bit of a backstory, how long ago was the injury?
I think it started in February when I ran Groundhog, and then I've run
So-
multiple races since then.
So we're looking at about 9 months already, right?
Mhm.
And how many marathons have you run since February?
9 plus Riverbank. Is that too much?
No, I'm not going to even answer the question. I'm just going to pose out a few things here. You're not your average Achilles tendonitis, right? That heals quicker. But at the same time, you have been able to do a few things.
I have
Yeah.
been.
9
But it's-
marathons.
Yeah.
But
What do you
man,
mean? What do you mean?
Did you listen to the last episode and how long it took me to finish a marathon just recently?
The one that
just
came out
Yes, today.
today. No, and not yet. I've been a little busy today.
Spoiler alert, 5.5 hours.
Oh,
Well, actually 5 and 42.
42. I wasn't last though.
okay, that's good. Some days it's okay being at the back of the pack.
Well, some days it is.
So how did that race go? I know you've talked about it, but were you limping?
The Achilles didn't bother me as much as my right hamstring during that race. Because I haven't seen you since.
Yeah.
Because I haven't had time to get in. So I haven't been in.
You said it.
Sounds like he needs one of those 5 session packages on the Ultra G.
Only if he shows up, it helps. No. But I think the biggest thing with Achilles, and this is a part of the issue that you're dealing with, right, is you do have an Achilles, tendonitis. And tendonitis means that it's a tendon that has some inflammation in it. But you don't have like a tear where you're unable to run. And therein sort of lies the problem with a lot of the people that we see. Because when it's just an itis, they'll throw down a bunch of ibuprofen to manage the inflammation. And they're able to get through their events, which then makes them, for lack of a better word, like a little cockier. That's like, yeah, I can do this. I don't need to do anything else.
I can just put ibuprofen in me and get through all
Exactly.
this and not have to worry about it.
Until it continues,
Yeah.
on and on and on to the point that it's like drives you nuts. Now, a tendon does not have really great blood supply. And this is why we try to manage the expectations of how much you're moving it and put you in the boot and give it some rest. And because, with Achilles especially, it's like unlike a shoulder tendonitis where you can pretty much avoid shoulder movements. You can't avoid stuff with your Achilles if you're standing up, walking, moving around. Even if you're sitting all day, there's so many different positions you can put your foot in that can strain your Achilles. Whereas when you put you in a boot, it's fixed in one position, and that just helps to unload the tendon. So there's that segment of a tendon does take longer to heal. Now there are things that
Than a muscle.
Than a
Than
muscle.
a true muscle. Okay.
Muscles have better blood supply, so it's going to heal better, right? Again, this is based on degree of strain, right? So that's why when a tendonitis gets to the point of an Achilles tear, muscle tears can sometimes heal without surgeries, but tendon tears won't.
Okay.
So you have to reattach that tendon.
Yeah, and that sounds like not a good time at all.
It is not a good time. But it does heal. And actually, I just had a couple of weeks ago, I had one of my patients who I saw, I think 1.5 years ago, with an Achilles tendonitis that led to a tear that it was repaired and then he retore it accidentally and repaired again. So he had enough complications in it. But in that journey of 1.5 years, he was able to complete a 70.3 distance, triathlon.
Okay.
And he was excited that he could actually get to that point. So my point to you is that sometimes it may be a step back from all the crazy things that you're doing to let it heal. Or you may go into the other extreme of you keep doing it, something's going to really give and it will shut you down. But either way, you will come back. So don't let the moments define you.
Well, that's the part
in what you're doing.
Right. That's the part where I was talking about the psychologist,
Right.
because sitting around doing nothing, we talked about this in just your episode too, is just sitting around doing nothing. Oh my gosh. I am not having a good time with that.
But you don't do nothing though. You got to do something. You just don't run.
That's everything.
No, it's not.
I'm just sitting back and going, all right, Terrence, preach. Come on.
That is everything, though.
Yeah, and
that's what I do.
Again, absolutely do it then, but then you pay the consequences.
Yeah.
So,
well, that's where
it's not like right now. It's not like if you keep doing this, you're gonna eventually tear it. It's just that if you keep doing this based on the integrity of the tissue right now, you're just gonna keep irritating it. You're not doing anything explosive enough that I'm worried about a tear.
But it could.
Not with his Achilles the way it is right now. So again, so what's just going to happen is it's just going to take a much longer time to heal. So for example, I had a bad sprain on my ankle while I was running, stepped into a pothole. It took a year before that calmed down where I could run and like not think that or not feel any pain in there. It didn't stop me from running. I didn't stop running. I kept running. I did what you did. So my advice isn't that you stop running. My advice is to adjust your expectations.
Oh, I am your classic bad example. When my back was messed up, I ran for months until I couldn't stand up straight.
Right.
Like, don't normal people do that? A lot of runners, right?
A lot of people do. When we talked on one of our episodes about secondary injuries, right? By the time someone comes in to see us, it's not the primary thing that brings them in. It's something else that then jacks up. Like pretty soon you'll be coming to see me because your hamstring strained, not because of your Achilles.
Yeah, what hurt in the race?
Yeah.
That's weird. I mentioned this. My arms hurt.
Your arms?
I don't know why.
Because
my whole body
when you run, and he hasn't ran a ton in the last 12 weeks or 6. What was it? 6. And then you get back into a marathon,
right?
And you're doing small little curls for 5 hours and 45 minutes. That's a lot of little curls. And his arms are.
If only you had an upper body program that you could be doing.
I might be. I'm thinking about it. Terrence, my only issue is it's a bit of a drive. Like for me to come from Holland to get all the way out there.
I don't disagree.
But if I only did it, if I was able to do that and come out once a week and then actually follow through and do the stuff. That's why I asked in that episode about learning stuff that I can do at home with what I have.
Right. I think,
but it's a follow through. I have to do it.
And from a weight training standpoint, I think that's really legit to be able to do stuff at home. And I've adapted the program, especially for upper body, where you can do it at home using just band weights.
Okay.
However, I'm not opposed to you continuing to run if we can modify your running environment. So, for example, if you came in and ran twice a week on the Alter G for whatever, 3 to 10 to 15 miles, I mean, we can make that happen. That's why we have 2 Alter Gs at the practice.
I have a really cool thing called the Platinum.
Yes, you want one.
I said that quiet because this is out before the episode. But
yeah, it was funny because Sean texted me this morning about wanting to do 15 miles. I'm like, I basically said, well, it depends on what your expectation is.
We have a regular treadmill right next to the Alter G.
There you go.
Right.
No, I think so. Are you creating more harm to your tissue by continuing to run?
I shut it off over the weekend because it was bothering me enough. I was like, I know I can suck it up, but sucking it up has probably gotten me to where I am now.
Right.
So it's like trying to get it to calm down.
Yeah. So there's a bunch of things that we still haven't addressed, right? We tried to take care of the acute issue that you were dealing with at the time, which was just tightness in the posterior tibial tendon into the gastroc, down to the Achilles tendon, right at the calcaneal insertion. So again, all the technical stuff that we in physical therapy will address. We haven't talked too much about, kinesiotaping or using compression socks while you're running, or, what is your rest recovery? How much are you running? Is there a way that you could manage the amount of running where you're still getting value from the runs, but not doing excessive mileages?
I did. Like I did a marathon a couple weeks ago, but other than that, I've been running 3 and shutting it down.
3 miles or 3 days?
3 miles and only a couple days a week.
So how many is a couple of days?
2.
So you've been running 2 days a week.
Not even like I ran 2 days in a row though. And maybe that's
You
what
see the shocked look? He's actually like
I
in
know,
a bad
but
place.
I did.
But at the same time, like, again, think like running 2 days in a row, that doesn't make any sense either, right?
Yes, it does. You
No,
can run every day.
because you're creating cumulative trauma. You need relative rest.
I felt okay the next day, so I went out.
It felt good because it's actually trying to heal.
Thank you, Lewis. See,
You go out and hurt us some
listen
more.
to Dr. Lewis over here.
I admit I'm an idiot.
Okay, should have started with that.
That's why everybody knows this already. That's why I need that. I need somebody next to me that's like, no, stop. My neighbor tries to do that, but nobody stops me because otherwise there's the crazy in me.
Well, yeah, and again, so here's the thing: there is no secret sauce to like do these things and you will get better,
I know,
right?
That's what I'm looking for. And I know
yeah.
better.
And so every single thing you do needs to be like, we need to manage the expectations for each run. We need to make sure that you're understanding when you're supposed to be running and what are you supposed to be doing in the days in between. Those are the longer term things that would give you the relief that you need to get you to the next run.
I think what we need to do, Mitch, is when you feel like you want to run, we're going to send you a link to the Bob Newhart Saturday Night Live. Stop it.
That was my favorite. That is my favorite.
Stop it.
Have you seen that one?
No.
Oh my
You
God.
know, this is Mitch.
I'm going to have
This
to look.
is Mitch coming in right now.
I'm sure I'll get a link on this.
Yeah.
Oh my gosh.
This is what Mitch is asking us for right now.
Well, sometimes I do this. Okay, are you done? I think so. Stop it. And he just yells at him. It's like, well, this, and he's like, stop it.
This is Mitch, what Mitch needs from us right now.
The thing
That's
is,
a good
though,
point.
as much as this becomes an all about Mitch session, hey, that's new. It's a Mitch session.
This is the Mitch session.
Yeah. So there are a lot of athletes that are doing exactly what you're doing.
I know. That's why I wanted to bring it up.
Yeah, absolutely. So I think this is helpful for athletes to understand that, we're not saying you need to stop. We're just saying you need to manage your expectations, right? So if you want to keep running because you just have to, you're going to be hurting for a much longer period of time. If you are unable to make it into therapy or into, some sort of alternative training, then, something's got to give. So let's work on figuring out, well, how, what I love about the way you're experiencing things right now is that there are people that don't have the opportunity to get into a therapy practice. Right. And how do we help those guys still get through whatever, on their own? Now there are patients that will actually send me messages like, okay, I did this, and this. What should I do next? So then that's a question. And then there's like, I did this, and this, and here's how it felt. That's like a report. Yeah. So if you want, I'm happy to look at a report and go, okay, so you did it. You didn't die. But then if the answer is like, what should I do? But if the question is, what should I do next? Then usually there's some things that we can add in there that we can clarify a little bit more. Okay, so where did you run? How fast did you run? Was it your normal pace? Was it faster, slower, same shoes, different shoes? There's so many things that can change how we run. Just improve that.
I think I do need to make an appointment for next week just to set the record.
Sell packages. You could save some money.
Well, we'll talk about that too. But,
you wanted to throw in packages again, didn't you?
Mitch likes
I want his package.
He's got 2.
I got a great package though, like 5 or 9.
5 or 9.
Right.
That's a discount.
We're talking about weeks, though, right?
No, it's sessions.
Number of sessions.
Sessions. 3 months or 6 months, depending on 5 or 9.
Anyway.
Like that, yeah. So
there is hope.
Because maybe we can tape the crap out of it too, And
like tape it as in record it or can you do tape it?
Make it immobile and I can run with like a peg leg.
Oh my goodness.
Oh, we can chop it off at the ankle as you requested.
Something.
Yeah.
No, I think there's definitely some things that we may be able to do in between to help you through this. And there are some tools that we've done some electric stim on you. I can't remember if you have.
No, we have not. So I've heard other people doing that.
Yeah, so we have that as an option, and
Just
then
take a plug, stick it right in the wall, and those two.
That's like
yeah, something like that. It's like a cattle prod.
you get your own.
You got an old lamp at home. I can cut the cord off like that.
You can do it at home,
Yeah,
sure.
no, just take the handle of a screwdriver, hold on to the middle end.
Do not do that.
Yeah.
Nobody do that.
But no, we have. So what we do is we'll test it with how does it feel with electric stimulation or neuromuscular electric stimulation. There are portable units that you can actually take home and attach to those areas and wear it if the stimulation helps. And that will help someone like Mitch, maybe train that muscle for about 15 minutes or pre-treat it. Then you can get your run in and then post-treat it. So that way you have less long-term effect from the training itself. Making sure you have a good warm-up, a good stretch, things that you don't always pay attention to. But right now,
you have to pay extra attention.
I have been lately, though. I tell you, I've been actually stretching multiple times a day. I even got the foam roller out today, trying to put some pressure on that thing.
Yeah. So again, too much of a good thing is not always a good thing as well. So we got to make sure that you're doing the right thing. So, for example, some people say, I've been stretching the heck out of this thing. I don't know why it's not better. And that's because you've been stretching the heck out of it. That's why.
Yeah,
stretching is not about uncontrolled max stretching, for example. You'd want to get to the point where you start to feel the stretch, hold it for 30 seconds, back off. Even though you know you could probably stretch it further, you don't stretch it all the way on the first stretch.
I feel like I've been doing that, though. I've been careful. But so I've been making sure, because I was doing no stretching. So now I'm actually getting after it and trying to make sure that and the big difference, too, is when I first came in, you remember how tight my calf was? Like it was a big knot. Yeah. It's not a big knot anymore.
Yeah.
Like it's actually pliable. It doesn't hurt when I work on it.
Right.
The whole thing, because we worked on it for a while.
So you're heading in the right direction. You're just impatient.
Yeah.
But you're also impatient because the pain recurs, and the pain is recurring because you're running 9 marathons in 9 months.
Right.
So I'm not going to say you need to stop running, but I'm also going to say then quit whining. Because cause and effect, right? You've earned the right as an ultramarathoner to run as much as you want, but then know that there's going to be pain involved. I was having this conversation with Nick. He goes out and runs 5 miles the other day. He's just trying to get his, fundamentals in for a training program that we'll talk about and the Wednesday thing. But he goes out, he runs 5 miles, and he's like, it felt great. Now got it done in about an hour. Now this kid has not really run 5 miles before. The last run was like on the Alta G. And then the next day he's like, oh my gosh, I can't walk. And then the next day it was even worse. And I'm thinking, part of me wants to say, just suck it up. It's normal. It's normal to have pain after you do things like that. But at the same time, he's experiencing it for the first time. And how do I manage his expectation?
Yeah.
So it's the same with you. You've run how many marathons? 40 plus marathons. And
178.
Oh, 178. Okay, I was off by like 130. Okay. So you've run over 178 marathons
or further.
And at some point you've dealt with injury along the way.
Yeah, for sure.
Sometimes part of the issue that you may be experiencing right now is this self-induced stress of trying to get 50 states in as well. So you're like on a schedule and a timetable. I got to get this done.
Getting old.
I know. I get it. And the reality of life is that we age, but we still perform. And sometimes we do better as we get older. So we just got to take care of ourselves. And I think you can. I have hope for you. I know you can do this again. It's not the end of the road yet. So,
I think you should.
And there's always the blades.
Yeah.
That would
Oscar,
be sweet.
Yeah. I think you should be honest and write down actually what you're doing. Because you say, I've been stretching, I've been getting after it. But is it truly what Terrence would recommend and schedule? That's why I think a session and logging it, just like you would your Strava run, like not on Strava necessarily, but truly like, yep, I did 30 minutes of stretching and this is what I did. So Terrence then has something to actually fall back on and go,
tangible.
Oh, wow, you've been hitting it like what I would schedule. So now let's, I don't know. I'm not a doctor, but
I follow that. I think
Terrence could probably do a lot more with.
No, that's why when we talked in that last episode, we were talking about, like the actual the packages, right?
You were looking for something different too.
But getting in there and then going in, like 5 times, what's that look like? Is that 5 weeks in a row or is that twice a week? We'll work that out. But I was and that's why I asked.
It's customized to you, whatever you want to do with that.
And that's where I asked a very leading question. It's like, I want to go in because I want it to supplement what my real passion is. Like, I know it's necessary and I know I need to do it long term. It's not like I'm going to go in 5 times and be done and like I'm never doing this again. I need something that is going to supplement.
That's going to be pink and platinum.
Running. See, that's why you keep
you gotta put that on it's gotta be on one of those things that go around your neck too. And like
it's totally like the dog tag.
Does it come with a shirt?
Yes.
Yeah. Just like that.
His shirt will say, "But did you die?"
and I want to make sure it's make sure it's too short so my belly hangs out.
We can totally hook you up with that too.
Yeah. Oh yeah.
And then we gotta film you doing jumping jacks. But no, I think when it comes to your Achilles though, it is the bane of the of any runner. And sadly, not everyone has the same degree of injury, and which is why it's hard to compare. It's like, so and so had an Achilles injury and they recovered real quick. I was like, no, we're all in different stages of our lives, and you had some questions earlier about like nutrition and hydration and how important is that? Super important when it comes to healing and recovery. So look at all the components, and we can help you put all the components together to figure out what are you doing or what are you not doing. To Lewis's point, whatever you can give us in a report or some sort of, hey, here's what my week looks like when I run, when I train, when I stretch, when I do stuff. And you do not need, there's no wrong answer. It's not like if you tell me you did 10 minutes of stretching versus 30, one is necessarily better or worse than the other.
Right.
I just need to know what you're doing.
And I do try to warm up before I get out and I run in the morning. Yeah. My downside lately is we have a puppy. The best place is to try to go down and stretch down there and try to hit it with a gun. I don't want to wake him up because then I got to take him with me.
See, now you're like getting into this other. But
I'm making excuses.
No, not excuse. But you're touching on something else that I want to clarify a little bit as well. You said the gun, the Theragun, which is what I'm assuming it is, right? Not just a pistol.
I shoot myself in the leg.
Shoot my leg. I don't know why.
Maybe that would work better. There's like, there's a hole in there. That's why.
Now I can't run. Now I really can't run.
No, but I do want to just qualify to the listeners again that there's a lot of different vibration tools out there. Theragun makes something. There's Power Plate that we use at the practice a lot. But you can actually damage your tissue more by overusing those things or by using it on the wrong places. They work great in muscular areas. They don't work great in tendinous areas.
That's where you were very clear on telling me that. So I do not hit my tendon with that thing.
What? Really? Wow.
I do. Edit that out. Make that part fuzzy. Because it'll make it look even worse.
Do you want me to rewind this? I'll show you again and again. Over and over.
Oh my gosh. We really are 12, aren't we?
I think you just created your next meme.
We really are 12.
But no, I've seen, my wife is case in point. She's been dealing with this foot issue and she doesn't listen to me. She's a physical therapist and she doesn't listen to me. She thinks she'd know better, but she uses the Theragun, we have a Power Plate vibration tool, and she uses it like on a heel all the time. There's not even like, there's tendon attachments there. And she goes, oh, but it feels so good when I put it on there. I'm like, of course it does.
I do not get around that
but
tendon.
not just for you, but just for the general listener here.
But they
Just
need
be
to know
careful where you use the vibration technology.
Muscular.
You want to use it in muscular areas, not near bone, not near tendon attachments. Those can irritate that area. And we typically we recommend no more than 2 to 3 minutes at a time. And probably give yourself like an hour in between. I swear, my wife is like, she'll put it on, but I only use it for like a minute. But then like 3 minutes later, she puts it on again for like another minute. I'm like, I can't say anything. Yeah. I'm hoping she doesn't listen to this podcast.
Want me to talk to her?
No, you don't. You don't need to do
that. What's her email? I'll send her a link.
I'm only here to help.
Breaking marriages. Huh?
I don't want to do that.
No, if that's how it's going to work, we have bigger problems. No, just the word of advice on the vibration technology though. Is just be judicious how you use it. If you're not sure, we're happy to give you some advice depending on where you need to use it and which muscle or tendon, or which muscle or which limb.
Well, that's interesting. I've never, like I know you told me to stay away from the tendon and things like that, but I've never heard like the time limit on it too. And I think that's important. That's important for people to hear.
Yeah, and we've done like multiple. I mean, I'm reading stuff all the time, and sometimes when I read something, I don't always just go, "Oh, so this." I want to go back and validate that. So I discuss it with my colleagues. We try to make sure we're on consensus as to what makes the most sense. And so even when I give you that window, 1 minute on a calf may be good enough versus 3 minutes on a quad.
Yeah,
much bigger, bulkier muscle, greater. So that's why everything is really down to where you're using it, and there's different settings on these units as well. So just be aware that more is not better.
I know that is a new, that is such a different way of looking at it because. Yeah. I brought it up before.
It applies to runs as well, Mitch.
Everybody thinks more is better, but more miles is better. We're not taking that away.
Not always.
Anyways, did we give a little bit more clarity to your running issue?
Yeah, for sure.
And I hope those that are listening understand exactly what we're talking about here. And that is, to summarize this a little bit, is with so for in Mitch's case with an Achilles, may or may not have to immediately stop. Good chance you don't. You and Mitch both, case in point. So those listening, if you can, though, go in and see a PT.
Get medical advice as best as you can. Take everything in. Discuss it with multiple people so that you know that you're on the right track. Sadly, there are people out there that don't fully understand this, clinicians that don't fully understand this, and they're giving out advice that is not necessarily good. So just, get with the right people.
And to that point, I think it's important to say that every case is different.
Absolutely.
So that's why it's important, if you can and you have the ability, to get in and see a professional that they can actually diagnose.
Yeah, this is not a diagnosis.
That's my personal, like I want to use myself as a guinea pig and make fun of me. That's fine. I do really dumb stuff.
Right.
But
easy target.
That's right.
And I, I wouldn't suggest people do that, but
yeah. Well, I think, again, another bit of advice that I would give to listeners is that if you tell your clinician that I have pain in my Achilles and they say, well, you need to stretch it and you need to do this and do this, without asking you any other questions, walk away.
Yeah.
Run away if you can still run.
You can still run away.
Because
limp away.
The key is really to try to understand your injury, right? It's unique to each person. Okay, Mitch, you have pain in your Achilles. Okay, how long has it been going on? What's been going on? What are you doing about it? All those kind of things matter before they can say, okay, based on everything you've told me, now do this or now try that.
Right. Yep.
Boom.
Cool. So next week, an appointment. Maybe.
Yeah.
Probably. Get in, get scheduled. We'll have an update in 5 weeks-ish.
He's been getting kind of busy though, so it's hard to, I gotta get on a schedule.
Yeah.
Well, you get that platinum card, I think you get right in.
I don't know if
platinum
this should be
pink.
I don't know if this should be
pink card.
Common knowledge, because I don't, but Rudy gave you big kudos that you took care of his future son-in-law, maybe, on a Saturday. Came in and took care of him, and even dropped him off at his house.
What?
Like he
concierge service and all?
We treat you like a pro,
Wow.
man. We mean it.
he had really nice things to say about you. So
good.
like,
I'm always happy to help. You know that.
and it did. We went to a get together at Rudy's house. And Eddie was like, "Man, that saved me."
Yeah.
So
Good.
just for that was huge.
Yeah.
Awesome. Well, Terrence, thank you for diagnosing Mitch here on the air. And this is not a diagnosis for everybody's Achilles issues. This is Mitch's. And you should all, if you have those issues, reach out to a PT and get checked out. And if all they say is stretch it, run away.
Or
Find a different
talk
one.
to your doctor.
Talk to your
They may
doctor.
have knowledge in that and send you to the right people too.
Yes. But with that is this week's episode. And go to Facebook, go to YouTube, check out our Patreon, sign up there, join the team. You can do it for free, or you can choose to sponsor the show in some way, shape, or form. But that is going to wrap up this week's episode of the I Don't Know Running podcast. Be sure to tune in next time as we share more about what we just don't know.
I could be working on my mental issues, but until then, happy running.
Lord help us all.